So in February of 2024, we hosted a really important information-packed webinar on the power of policy. And we gave 10 tips on how you get things done in public health.
We received a ton of great questions from our engaged and advocacy-driven audience and didn't want to leave you all hanging.
So without further ado, let's dive into this bonus Q&A video on the power of policy.
The beauty of public health is that if you want to improve people's lives, there are so many different places where it happens. Environmental health issues, women's reproductive rights, it's a long list. You know them. It's not fragmented. We have so many different areas that we have to work. They are rich and ripe with policy opportunities, and we do need to dig in and burrow in. But the beauty also of public health is that we're united by some very common themes. We're addressing the vast inequities out there, dealing with structural racism that sometimes is baked into those policies or might be unintended and that we need to dismantle. We're looking at how do we create a sense of social justice in all of the areas that we do. So regardless of the specific area that someone is working in, they're all connected. And so the key is, how are we effective in each of those areas, and how do we tie them into this bigger picture of what public health is all about? And that's where we do need to be smarter and more combined in how we do our advocacy.
There is absolutely sometimes a tension that exists between social needs and focusing on policy, but these are ideas and approaches that I don't think should be in direct opposition to one another. I think it should be a both and approach. I mean, direct service work is critical, right? Individuals need access to medicine and casework and resources and other services in real time. But often those interventions are more downstream, and they are not necessarily designed to address the root causes of poor health. Policy, on the other hand, is a tool that can address those root causes, that can help to build the conditions for optimal health. And so I think we have to have both approaches. I think they must coexist. And I think sometimes it's just a matter of socializing these ideas early and often with your team, with your department, to get that buy-in for why you should continue to pursue policy. But again, I think both aspects of this work are necessary.
Such an important question because no one should feel like policy isn't relevant to them. So one of the things that I like to remind people of is that even if you do clinical research, policy impacts how you do your work. For example, policies related to the Institutional Review Board or policies related to federal funding. Like, there's so many ways to be engaged in that work. One of the things that I think is important is to think about, how is your work policy relevant? If you're doing work on a cell or trying to understand something very intricate that may seem small, think about the broader impact. What's the so what? And I have found that when I've worked with people who are in clinical sciences, that starting from that place has helped them to get to understanding how their work is relevant for policy. Are there institutional policies that might be relevant to your work where you can then be engaged? And many of the strategies we talk about are related to public policies, but certainly there are some that are also relevant to changing institutional or organizational policies to help to support your work. Regulatory policies, regulations are also really important for sciences and clinical sciences. And so that's a place where it's important to educate yourself on as well. Are there regulations that might impact how you do your work? Or do you have an opportunity for your work to influence regulatory policy?
Well, let me give you a few basic tips. I'm going to say, number one, chances are it's not lobbying, but you need to know the rules on what is and what isn't. And it changes based on what state you're in, what your employment situation is. Is it at the state level? Is it an agency? Is it federal level? So you need to know the rules. That's one. Well, two, this is a personal decision. And you have to determine, is this, if it's lobbying or engaging with a policymaker, is it you as an individual citizen? And it doesn't matter where you work. You don't abdicate your ability to engage with a policymaker as an individual voice, as an individual citizen. If your employment situation says you can't engage, well, you got to respect that. But consider how you could do it and should you do it as an individual, because your expertise, your knowledge is yours and could be very valuable. But third, all of this is part of a balancing act on what makes the most sense for the situation that you're dealing with and for you personally being an effective advocate. In the book that we wrote on policy engagement, we spent some time talking about how to go through and the balancing of what makes sense for your values, your situation, just your own personal comfort skill level. It may be that you're really good and can be just as effective in providing background information to policymakers that doesn't have to get anywhere near the level of lobbying or high visibility, but you could be a really valuable resource. And so again, I gave you 3 tips here, but it all comes down to what is comfortable for you, what makes the most sense, and how to do that right balance. And for every situation, it's going to be different. It's fundamentally all about what you think is right and comfortable in going forward.
I think it is so important for those who are not in public health to engage in policy, because policy touches all of us. I often tell my class that even if you order from a large retailer who delivers to your house, their return policies impact you, right? Like all of those policies matter to all of us. One of the areas where I do a lot of work in, and we talk about this in the book, is called health in all policies. And so thinking about how decisions of other sectors can influence public health, it just emphasizes how important decisions made by people in housing, transportation, energy, any area can influence health. For example, if you're working in housing, think about how your decisions related to affordable housing can impact health. They impact health in terms of allowing families to have access to affordable and quality housing. Or you can think about the federal LIHEAP program, the Low-Income Energy Assistance Program that is federally funded and gives money to states to help eligible households pay a portion of their home energy costs. That's part of policy. And so I implore all of you who are outside of public health to think about the ways that the decisions you're making can impact health. We need you at the table. We need you involved in policy. We need you involved in thinking about how those decisions can help to advance health equity and can help to advance more equitable choices that can really improve health for everybody.
Media advocacy is such a vital component of driving policy change. And if you're in a public health department, equip journalists and publishers with your evidence. You have data, and the data tells a story. So make sure they have it. Often they don't have access to things that they can't publicly find. And so you are well positioned to arm them with the information that they need to tell a compelling narrative. The other thing is that most journalists and publishers are on social media. So follow them, tweet them. I don't know if that's the appropriate term now that it's X, but you get what I'm saying. Engage with them. You want to think about journalists and publishers in much the same way that you think about policymakers, and engage them as valuable stakeholders so that you're able to tell those stories. Share your evidence, connect them with other folks in the field. and help them share your messages far and wide, leveraging the platforms that they have.
One of the best tips I can give you for engaging and providing information and comments to an agency is go watch the Learner Center video. It's great, short, sweet, and really gives you some good insights on how to translate your knowledge, your expertise, your public health experience in a way that's going to have the best impact for an agency in their decision making. Now, yes, you probably could submit anonymous comments. And as a quick aside, every agency is going to have its own rules, if it's federal, state, local, so you have to take a look at would they accept it. Chances are they would, but you also enormously put your insights into a disadvantage because you are a credible, highly respected resource. Don't waste it with anonymous information. The fact that it's coming from you, a public health professional, has value right there. So be succinct with your information, explain why your perspective is an important insight. It may be experience in the field, it might be from research you've done. There's no harm in explaining who you are in that kind of public health context. It just adds that much more weight and value. So yes, you can, but take advantage. We need you to step up and be seen, and there's no harm on that one.
Tactically, if you are having a hard time breaking through the noise, it may not be the message, but it may be the messenger. And so try to find out who has the ears of the policymaker that you are trying to influence and equip them with your messages, just so that the policymaker might hear and receive that information differently. So again, that's a minor sort of tactical tweak that I think can start to get at this. I think the other thing to really keep in mind is that in policy, there are often no permanent enemies and no permanent allies. And as attitudes over time shift, as positions on issues evolve, as new evidence emerges, there's going to likely be a scenario where someone who was previously in opposition to you is now aligned with you. Try to stay attuned to those sort of changing of the tides and then seize the moment and just stay in it. And then the final piece of advice, and this is the more overarching aspect, is really just to stay the course and be persistent. Policymaking can be incredibly frustrating. It can take quite a bit of time, but it's necessary to just be persistent and stay the course. In the book, we uplift the example of Tobacco 21. This is the policy that increased the age of sale of tobacco and nicotine products from 18 to 21. And it first passed in Needham, Massachusetts in 2003. But it wasn't until December of 2019 that it became federal law. That is 16 years of sustained advocacy effort in the face of a very powerful tobacco lobby in jurisdictions where the political climate was not favorable. But nevertheless, those advocates on the ground, public health champions across the country, we just stayed in it and we persisted. So keep up the good fight.
We in public health bring a lot of things to the table when we engage on policy work. We have our expertise, we have research and facts that we can bring into efforts, and we have experience in working out in the field, all of which are very valuable to policies. But that alone is not going to make policy change happen. It is so important that we are engaged, working in collaboration, and many times that the work we do in policy arenas is actually informed and fueled by the people, by the communities that are most impacted. It's where, if we're really going to be successful, we have to have those strong collaborative ties. And sometimes we have to be working on issues that might not be what is on the top of our agenda, but in fact, we've been asked We're needed by community groups, by people who could really benefit from us standing with them in those policy arenas. So how do we engage the public? Well, first we got to develop those relationships. We got to be out there and say we are willing to do that hard work. We will work on their agendas. And then we have to make sure that we're hammering out those policies that's being informed by their needs and priorities. It has to be a two-way street. And the more that we develop those relationships, the more we restore the trust, that's when we're going to have people standing up and working with us side by side in fighting for public health. The more that we earn the trust, the more we're recognized as we'll be there when they need us. And the more and more we can build those coalitions, that collaboration, that understanding that public health is there fighting for the common good, that's when we're going to not only help create healthier communities, but we're going to generate more political will and support for public health overall. It's an absolute win-win.
I think self-care is critical. And I want to begin by saying two things. Self-care is not selfish. And I want to quote Audre Lorde here, who once said, caring for yourself is not self-indulgent. It is self-preservation. And this work is hard. I think doing policy work is so valuable and important, and it's hard, right? Being persistent, showing up every day, having to make arguments that seem so obvious to us that people aren't fully understanding, or sometimes the political forces feel so great. I think practicing self-care, and I would say radical self-care, radical love for yourself is so important in order for us to stay in this fight. And so what does that look like? For me, it looks like being self-aware of my energy levels. And so, for example, there are days where I know I can't show up and do this work because I need to refill. And so for me, it is then sort of having time to be quiet, to enjoy time for myself, whether it's resting or reading or whatever it is, to just kind of take a step back to recharge and refill my cup before I go back out into the space. It also involves having community. We've said in the book, we've said on the webinar that it's know your village, know your people. And I find a lot of strength from being in community with people who are also working towards the same goals, who have the same values and same vision for the world that I have. And I find that there's healing and power in that collective group and collective community. And then finally, it's about knowing my limits and knowing when I need to say no, and knowing when I can lean into something. And sometimes it's not always a no. It might be a not now or not today, but knowing when again, I'm able to come and be at my best, because again, this is about a marathon. This isn't a sprint. If it was a sprint, policy change would happen immediately. But so much about policy change in the process is a marathon. And so in order to run that marathon, to run that race, we have to center self-care, and we have to take care of ourselves and also take care of each other. So I think radical self-care, radical love for yourself is critical for all of us who are working in this space.